Hello, welcome. I'm Dr. Tony Malioco, the Cancer Informant. Today's episode will focus on genetic testing. Genetic testing is an important option for patients with cancer. There's quite a bit of confusion about genetic testing. First of all, there are two different kinds of genetic testing that are suitable for cancer patients. The first type is testing the tumor itself for alterations in DNA that are called mutations. You actually need a piece of tumor to test this, and this is called somatic testing. This is quite useful for selecting therapy for certain types of cancer. We're going to talk about that in a different episode. Today's episode about genetic testing will focus on germline testing. What is germline? Germline is the fundamental genetic code that you have inherited from both your mother and your father. It is essentially the blueprint for your entire being. And from it, from the stages of embryo to adulthood, the genes are utilized to make your body's tissue. If you haven't inherited an altered gene or mutated gene from one of your parents, you can inherit a genetic condition that can manifest itself as a disease. These are called inherited diseases. Now, you get one set of genes from each parent. So there's two genes for each gene in your genome. Every cell in your body has a complete library. What this means is that you can do a genetic test on any piece of tissue from your body. This could be a piece of normal tissue, this could be blood, this could be a cheek sample. Many conditions are inherited or they're passed on through the generations so that you inherit these alterations from your parents. A good example is inherited cancer syndromes. There are certain families that have very high risk of developing cancer within their family. Much work was done on this over the last 50 years, and the genes associated with these cancer families have been identified and characterized. Because of this, we can now test individuals to see if they do carry these altered genes that predispose them to cancer development. Now, why might you want to have a genetic test? There are two real reasons for genetic testing. One is to determine your risk of developing a disease like cancer, and secondly is how to treat the disease if you actually have it. So testing your germline can tell you if you carry one of the cancer predisposing genes, and if you do, this could indicate you have an increased risk of developing, for example, breast cancer during your lifetime. There are many cancers that are associated with hereditary syndromes. These include cancers of the ovary, of the breast, colon, pancreas, and prostate. We're also learning that many other cancers may also have hereditary genes that can drive them. Now, if you do inherit a cancer risk gene, it does not mean that you have the cancer or that you are destined to get it. What it really means is that you are at an increased risk of getting cancer. Now, one of the good things is that if you know you are at increased risk of getting cancer, you can modify that risk through a variety of means. One would be altering lifestyle, so reducing factors that might contribute to cancer, such as reducing smoking, reducing obesity, alcohol, or other carcinogens. This can decrease the probability of getting cancer. The other thing that you can do is if you do know that you're at an increased risk is to have a more enhanced screening program, which means, for example, if you know that you're at increased risk of colon cancer, you might embark on colon cancer screening at an earlier age. More drastic measures could be prophylactic surgery. Patients who know that they have an extremely high risk of developing breast cancer or ovarian cancer may decide to have prophylactic mastectomies or oophorectomies. Interestingly, tubal ligation can also dramatically reduce the risk of ovarian cancer. So these procedures might be considered in patients who carry hereditary cancer-associated genes. There is some new research that is being developed that there may be protective agents or chemopreventative agents that might possibly prevent the development of cancer. This is still experimental. But if you did know that you're from a high-risk family, this could be useful for modifying the risk of developing cancer. Now, the second reason to have the genetic test is if you have cancer already and are from a cancer-prone family or have a cancer that is typically associated with genetic risk, for example, ovarian cancer, knowing if you carry the gene can be important even if you have the cancer already. This is for a couple of reasons. The first is selecting therapy. There are now certain therapies that are available for people who have cancers that are driven by genetic factors. A good example is BRCA1 and 2. Individuals who have cancers associated with BRCA1 or BRCA2 mutations typically get a type of cancer that has a DNA alteration called homologous repair deficiency. These cancers that have HRD respond very well to a new type of drug called a PARP inhibitor. Therefore, if you do have ovarian cancer or breast cancer, it is recommended that you consider genetic testing so that these new therapies could potentially be considered. Another type of inherited cancer is Lynch syndrome. Lynch syndrome is a very interesting type of inherited cancer syndrome where the genes that drive it control something called mismatch repair. Every time your cells divide, there are possibilities for mismatches to occur in the DNA. And in normal cells, there is repair mechanisms that repair this mismatch and keep the cells normal. In people that have deficient mismatch repair, they accumulate mutations that can lead to cancer. Now, the other thing about these individuals, they tend to have very high mutational loads in their tumors that can lead to something called increased frequency of tumor mutational burden, or also the development of neoantigens and a profound immune response. Individuals that have mismatch repair, part of the Lynch syndrome, tend to have very high tumor mutational burdens, and they also respond dramatically well to immune therapy. Consequently, it's quite useful to know if a patient does have underlying mismatch repair deficiency or carry one of the genes associated with Lynch syndrome. Here we can see that there is use for genetic testing in both before development of cancer and also after the development of cancer. Also, if a patient has developed cancer already and is known to be a high-risk individual, a different type of surgery might be considered. For example, if a patient has breast cancer and is known to be from or carry a high-risk breast-associated mutation, breast cancer risk mutation, they might consider more extensive surgery. For example, prophylactic bilateral mastectomies rather than just a lumpectomy. They might also consider ovarian oophorectomy because they could be at high risk of ovarian cancer as well. So knowing this information can help modify the treatment planning. Who is eligible for genetic testing? Well, currently the guidelines are always changing, but generally people who are thought to be at high risk of belonging to hereditary cancer families are the ones that are most suitable for genetic testing. How do you know if you belong to a cancer family? Well, if you do happen to know your family history, and if you learn there's a lot of cancer in your family, and what do I mean by a lot? This means more than one or two members of your family have developed cancer. Also, if they are directly related, for example, if they're brothers, sisters, mother, father, grandparents, these are considered first-degree relatives. So if you have more first-degree relatives who have cancer, this could be an indication there's a gene running in your family. Also, an indicator of cancer-associated syndromes is development of cancer at a young age. And by young age, we mean below the age of 60 or even below the age of 50. So sometimes we do see the development of cancer at very young ages. And if cancer is developing at a young age, a hereditary cancer syndrome should be considered. The other indication is if a patient or a family member has more than one type of cancer. For example, if a person had both breast and ovarian cancer, or if they had bilateral breast cancer, this could be a good marker of genetic risk. Unusual cancers can also be a strong indicator. For example, the development of breast cancer in a man could be a strong indicator that that man has inherited a genetic mutation. And this could also provide important information for other family members who are related to this particular individual. Other cancers, like certain types of thyroid cancer, for example, medullary cancer, the thyroid, and triple-negative breast cancers are much more likely to be associated with inherited conditions. So this may tip off a doctor that this could be a cancer family syndrome. Now, moving on into how is the test actually performed? Genetic testing is generally an easy test to perform. Now we can do the test on a saliva sample or a cheek scrape using something like a cotton tip swab. This is very easy to collect DNA and transport it to a lab to undergo the testing. Blood can also be a useful source of material for genetic testing, and also normal tissue that's next to a cancer could also be utilized to evaluate the germline. Now, there are many different genetic tests that can be done. And really the difference is generally the number of genes that are tested. Some of the panels that are currently being offered could be very small. And this was particularly 10, 15 years ago because genetic testing was very costly, and we also didn't really know a lot about genetics. The test tended to only test 1 or 2 genes. Today, we can now test a lot of genes very efficiently with our new next-generation sequencing methods. So it's almost as easy to test all of the genes as it is to test 1 or 2, and the cost can be quite similar. So now more extensive panels are generally utilized to cover more genes. So the more genes that are covered, the more likely the test will be comprehensive and will not miss an important mutation that could be contributing to a cancer family syndrome. If we think about the human genome, there's actually over 20,000 genes. That's a lot of genes for testing and a lot of data. We only know that a few dozen or a few hundred at most may be involved in hereditary cancer syndromes. But if we do that broader testing on an individual, we'll actually have information about other medical conditions in that person. This could give us information about whether this individual carries genes associated with risk of developing cystic fibrosis, cardiovascular disease, mental cognitive dysfunction, or other problems. So broad-scale genetic testing can actually be quite useful in helping an individual understand what other medical conditions they may be prone to. There are new advances in genetic analysis as well, that we can now analyze the genetic information to determine if you carry genes that may make you at risk of toxicity when exposed to certain medications. And this can be quite important because we know that some individuals can be extremely sensitive to certain medications, and certain medications could be extremely toxic. So if we know in advance that an individual is particularly sensitive to a certain chemotherapeutic agent, we could avoid that and avoid toxicity. This is not currently the standard of care, but in the future, I expect it will become more prevalent that we will need to test individuals for a variety of genetic indications, including toxicity to treatments and drugs. Another part about genetic testing that's important is that I strongly advise that someone undergoing genetic testing should consider counseling. It's very useful to talk to an expert in genetics prior to getting the test to determine what is the purpose of the test, how is the test done, and what the results might reveal. In this instance, a patient can make a fully informed decision if they want to undergo the testing. Both pre-testing and post-testing counseling is strongly advised. After the test is completed, it's also useful for a patient to consult with their counselor or expert to determine what exactly do the results mean, because these tests are very complex and the results can be quite confusing, although they are extremely informative when managed by an appropriate expert with knowledge about genetics. Also, the information from some labs can be kept for the patient or given to the patient so that they can keep that for the rest of their life or share it with their practitioner or family members, as this information can be extremely useful. In fact, in some countries, they're now considering testing all individuals at birth so that their genetic record can be recorded and made available to practitioners to help determine what diseases they may be at risk of during the course of their lifetime, and having that information in advance so that they can plan treatment accordingly. So genetic testing can be extremely useful in those settings. This concludes our discussion of genetic testing. For a brief summary, genetic testing is very important for cancer patients. There are 2 types. Number 1 is testing the tumor, or somatic testing. That's commonly done to match patients with specific therapies. The second type is germline testing, where we test, for example, saliva or a blood sample to determine what genes are inherited from the parents. This information can be very useful in determining risk of developing cancer, in making strategies to reduce the risk of cancer, improve screening, and to also select appropriate treatment for individuals who have already developed cancer. I hope you found today's discussion useful and will return for future episodes. Thank you for listening to today's episode. Please visit our website and leave questions if you have it, which we can address in future episodes. Thank you for tuning in to the Cancer Informant. Have a wonderful day. Bye-bye.